A woman asks, I've read several blogs that say having sex during your period can alleviate cramps. Is this true? And is there any risk in having sex during your cycle?
You may be slightly more prone to infections during your period because typically the vagina maintains a pH level, on the more acidic side, between 3.8 and 4.5. Right, throughout the month, but during menstruation, that level rises because there's a higher amount of blood. And then yeast is much more likely to grow more rapidly during a higher pH. Also, bacteria can travel up the vagina and up to the uterus and fallopian tubes and potentially cause an infection. This is more common during menstruation, but it can occur at any time during your menstrual cycle. A woman with HIV is more likely to pass the virus on to her male partner if she has unprotected sex during her period, but assuming you're both healthy, then period sex should be completely fine and helpful. Cramps are the #1 complaint that women have while on their periods, and having sex on your period can help relieve them. During your period, you release hormones called prostaglandins, and which trigger the uterus to contract, and then it helps shed its lining. Orgasms from sex can contract and relax the uterus, which then helps relieve pain from menstrual cramps. Aside from this physical relaxation, there are also feel-good hormones released when you have an orgasm, and these are called endorphins. Endorphins activate the opioid receptors in the body, which can temporarily relieve the pain that you're getting from those menstrual cramps. So you can get relief from cramps and you get relief from menstrual cramps and PMS cramps, as well as aches and pains related to your period, like headaches. You don't even have to have partnered sex to enjoy this experience. These benefits can also be produced because of masturbation and can be beneficial as well. Keep in mind, though, you can get pregnant when you have your period, especially if you have a shorter menstrual cycle and if you have sex towards the end of your period. People often think that ovulation occurs 14 days after your period. In reality, it occurs 14 days prior to your next period. So if you've got shorter cycles, it's more likely. And sperm can also remain in the vagina for up to 5 days. So pregnancy is possible. So it's definitely important to continue using your birth control.